Thank you so much, Dr. Meister. I really appreciate the opportunity to share this work with you today. I'm coming to you today from the ancestral lands of the Ramaytush Ohlone and Mwekma nations, and I do not have any financial disclosures. So my overarching project is Promoting Growth Mindset, a school-based intervention to promote learning and health in an underserved community. I am briefly going to describe our project so far and how we used community-based participatory research principles in the studies. We did projects 1 and 2 in the Tenderloin community at multiple sites, and the third one is in progress. This is very much a school-based project, and we really had to pivot and reorient because of the pandemic. So some of you may be asking, what is growth mindset? So mindset is a psychological construct that refers to an individual's view of the world. It has notable effects on attitudes, goals, and behavior. With fixed mindset, a characteristic is viewed as unchangeable. So for example, your abilities are based on innate talent. With growth mindset, a characteristic is viewed as malleable and subject to improvement. So for example, your abilities are based on effort. And this was really operationalized by Carol Dweck, one of our psychologists here at Stanford. So research in educational psychology has shown that having a growth rather than a fixed mindset of intelligence is associated with better academic outcomes for children. And this is also true in other domains, such as interpersonal with bullying, as well as health. And interventions promoting growth mindset have targeted adolescents and adults, yet little is known actually on how to promote growth mindset in young children, including how best to teach parents. So for my project, we knew that San Francisco Unified School District includes growth mindset as a core social emotional learning competency, but it really doesn't have a systematic way of incorporating it into the curriculum. And so in terms of our theorizing, our theory of change, we were going to target parents and young children, recognizing that they live in this ecosystem of teachers and school, as well as the community. And we hope that by providing parent education on growth mindset, we could increase parent knowledge and skills. We could change perhaps parent behavior with improving parent-child interaction and school engagement, and also change attitudes in parents so that they might think of themselves as agents of change. And we hope that all of these changes could lead to downstream improvements in child health, behavior, and learning, as well as parent empowerment and engagement, and that ultimately parents and children would have this equal opportunity for improved health, behavior, and learning. So, this was all well and good based on the growth mindset literature, but what would an intervention look like and how would it fly in the Tenderloin community of San Francisco? So to build an intervention, we really had to understand the community. So I want to tell you a little bit about the Tenderloin. It comprises 3.4% of San Francisco's almost 900,000 person population. If you look at total population by neighborhood, the Tenderloin ranks 6th. However, if you look at population density, so people per square mile, it's actually 1st, followed by Chinatown. That was something that surprised me. So lots of studio housing, lots of single residency occupancy housing. If we look at children in the Tenderloin under 18, it has about 9.4% versus San Francisco with 13.4%. And if we look at some economic indicators in terms of households earning less than $25,000 a year, the Tenderloin has 45% compared to San Francisco in general at 17%. And if we actually look at various census tracts in the Tenderloin, anywhere from 1/3 to almost 2/3 have households earning less than $25,000 per year. So we very much used a community engaged approach to start this project. One of our primary partners is the Bay Area Women's and Children's Center. This is a nonprofit founded by Midge Wilson, and among its many contributions to the neighborhood, probably one of the most important was their spearheading of a 10-year advocacy effort that brought a public elementary school, the first one, to the neighborhood. And my community site partner, Kara Wright, is a general pediatrician who has an MPH, and over 25 years ago, when she got her MPH at Berkeley, her thesis project was a community needs assessment. And she found that the children of the Tenderloin were not lacking pediatric care, but they were actually lacking dental care. And this led to the development of a free dental clinic in the ground floor of the school, staffed by UCSF. And she also runs a family advocacy program at the school. We had a number of other partners, obviously many teachers and school staff, principal at the school itself, and then various community partners, including housing development programs, after-school programs, and more recently, various reading programs. I just want to give a shout out for our bilingual students who were just amazing and really did a lot of work on this. Andrea and Esla were participating in an SF state program to bring underrepresented folks into graduate programs in science and medicine. And Esla is actually a native Arabic speaker, and she's an alum of the Tenderloin School. So she was really pivotal in reaching that community. And Annalise Montes is a first-year medical student at Stanford who did the Intensive Leadership Health Disparities program this past summer. And she just made some absolutely gorgeous parent education materials, which I will share with you later in the talk. So just to tell you about the two main elementary schools where we were recruiting parents for the first two projects. The Tenderloin schools, Title I, Reading, as well as also Title I. The Tenderloin has a Vietnamese language path and Reading has an Arabic language path. So our first project was a qualitative study, understanding and application of growth mindset by teachers and parents in an underserved community. So we really had to understand, what the community knew about growth mindset. So our questions were, what do you know about it? How are you applying growth mindset principles at home or in your classrooms at school? How would you like to learn more about what children and students are learning about growth mindset in these different settings? What features would make a growth mindset intervention both feasible and enjoyable? And finally, what are the barriers and facilitators to participating in the intervention? So we held these small group interviews and focus groups at community sites. They were led by the community PI. I was there as a note taker, and interpretation was provided by school staff or community coordinators well known to the families and from similar cultural backgrounds. So that was really helpful. And this is just a slice of the many results that we had. We met with 47 unique participants through 13 groups, 7 with teachers and 6 with parents. Teachers were very familiar with growth mindset. They said in every school that I've taught at, it's been talked about. It's been something that is explicitly taught. Parents, on the other hand, were unfamiliar with growth mindset terminology, but they demonstrated conceptual understanding when given examples. They said, your kids aren't stuck with who they are. People are changeable and they need support and encouragement. And teachers and parents really agreed when they identified similar barriers. They said language, cultural differences, lack of time and resources, limited literacy, and fear related to undocumented status are really big factors. Teachers and parents were uniformly positive about increased parent involvement and engagement and parents learning about growth mindset. And they wanted this to happen not just through parent-focused education, but in an integrated way with students and teachers as well through school events. So we took these results to 3 community advisory board meetings to share our results and also to get feedback on the intervention. Fortunately, before the pandemic, we actually were able to pilot the parent education component of the growth mindset intervention with Arabic-speaking parents. And our goals with this were really to test feasibility as well as the growth mindset questionnaires, which had all been translated. We had about 25 parents from the Tenderloin community that we recruited through community outreach. And we held 3 sessions in Arabic. And this is just to give you an example. This is a classic intelligence mindsets question. So the participant is asked to rate how strongly they agree or disagree with the statement. You have a certain amount of intelligence and you can't really do much to change it. We also asked them mindset questions in regard to health. Your body has a certain amount of health and you really can't do much to change it. We showed them actual activities. You can find these on understood.org. Very nice education, parent-friendly website. So this is an actual activity that teachers do with students. You have all these different statements. These are cut out, and then you sort them according to whether they're more of a fixed mindset phrase, such as I can't improve, or if they're more of a growth mindset phrase, such as I can improve with the right strategies. And this is just one quick result that we found. So there was a trend towards significance post-intervention for parents increasing their reported change in endorsing growth mindset. For health, there was not a significant difference, but you can see we had pretty high baseline scores in terms of endorsing a growth mindset with regard to health at the beginning of the study. So qualitatively, this was really important. The participants had a ton of questions about the surveys. There was a lot of social desirability. As you would imagine, many of them were not familiar. The Likert scale was a little bit confusing for them. So we really had to give them a lot of support to complete the surveys. And post-intervention, we were happy that the participants were really happy with the sessions. They wanted to include children in the meetings, and they wanted a lot of additional education on several child development topics. So finally, here we are at Project 3. This is where we are today. And, honestly, it was a little bit heartbreaking to put the intervention aside that we had worked so hard to create with the community. But there were just a lot of practical considerations. So what we came up with was Ready to Read, a school-based intervention to promote growth mindset and reading. So, we knew that school would be reopening, but despite it being in person, it wasn't clear this fall whether non-school personnel would be allowed and whether parents would actually be able to gather in a group setting. We knew that there would be a lot of pandemic-related learning loss. We know the school has low percentages of students who actually meet state minimum standards for English language arts and math, and this is pre-pandemic. And we knew there were a high proportion of English language learners there. And we wanted to be really realistic about expectations of parents and teachers, really acknowledging that the last, year and a half has been pretty traumatic for a lot of folks. So I just want to show you, this is a really diverse student body. So at the Tenderloin School, it's about almost 40% Hispanic or Latino, 15% African-American, 14% Asian. These are the categories that the SF Unified District reports. 4% Filipino, white non-Hispanic is 14%, mixed race 4%, and 9% declined to state. So at the time of this survey, they did not have a separate category for Arab Americans, and those folks may self-identify as white, declined to state, or African-American if they're originating from Egypt, Tunisia, or Morocco, for example. So very diverse school, lots of languages represented. Other student characteristics that were important to consider, 85% are considered socioeconomically disadvantaged, over half are English language learners, 11% have disabilities, less than 1% in foster care, but over 10% homeless, and 26% are characterized by chronic absenteeism. So lots of challenges. These are just the years for which we have most recent standardized testing data. So you can see, at least in these most recent years, there was a peak of a third of kids meeting state minimum standards for English language arts, and this dropped to about 27%, and this is all pre-pandemic. So I don't know exactly what those numbers will look like after this year of distance learning. So I want to tell you about this really interesting study done in Denmark. This was a Danish study that did a reading intervention with a growth mindset approach, and it was large scale. They randomized these classrooms in a trial, 72 classrooms, almost 1,600 second graders. They had a lot of political will and support to do this study, obviously. The intervention consisted of a booklet and access to online video with 3 major components. They emphasized a growth theory of abilities, so getting at that growth mindset. They encouraged this mastery-oriented approach and supporting children's independent engagement with books by talking about the content before, during, and after reading. And they placed an emphasis on praising child effort rather than performance. They gave all the children 3 books, resources on how to find more reading materials, and then schools and teachers, not the researchers, actually implemented the program. They had a log book where they could track their reading and they could earn some little rewards. And the control group got the quote unquote business as usual. And so this was published in PNAS. And it turns out that it worked. The treatment improved reading in 3 domains: language comprehension, decoding, text comprehension, and this held after 3 and 7 months. And when they looked at subgroups, the effects were at least as strong for immigrant children with non-Western backgrounds and children with low maternal education. And the effects were largest for children with parents who had fixed mindset pre-intervention. So that was in line with other studies of measuring fixed versus growth mindset pre-intervention. And the advantages were that it was scalable. This is obviously a much less expensive intervention than increasing time in school or doing remediation. So for us, we're conceptualizing our project as a pilot demonstration project at Tenderloin. All families of children in kindergarten through 2nd grade are invited to participate. It is research, so it is voluntary. However, all children will receive the free books because we view that as an equity issue. The intervention, children in each of these grades will be randomized to intervention or waitlist control. Again, we decided to do waitlist control as our design because we think from an equity perspective that anyone who wants the intervention should be able to access it. And we're stratifying by English language learner status. The intervention, again, consists of a packet of books similar to the Danish study. We have educational materials, both video and printed, in multiple languages, and I'll show you some examples. This is how to read together with this growth mindset frame, 20 minutes daily. Parents get 2 weekly text messages with tips and reminders. They get a link to a REDCap survey to log their reading progress. And at school, we also have a lovely ready-to-read family lending library where growth mindset and diverse books can be checked out by parents or teachers for read alouds and things like that. And our primary outcome is an objective reading standardized score collected by the school district, and the examiners are unaware of intervention status. So these are just some pictures of the early readers. This was probably one of my most fun parts of the project, was buying lovely children's books. We have books in multiple language. These happen to be the Spanish ones. We have some in Arabic and Vietnamese as well. Books with diverse folks. I think it's really important for children to see themselves in the stories that they're reading. And also many more books than actually what I'm showing here on growth mindset. These are some of the materials. So for the kindergarten parents, in English, in Spanish, tips about, if English is not your first language, strategies that you can use, how to read with your child before, while you are reading, after you have read in Spanish, how you can support your child's independent reading. Again, more tips with the growth mindset frame. And this is just a clip. I can show you a tiny bit of the video in English, and then we have it in multiple languages.
As a parent or caregiver, you play an important part in helping your child learn to read. Learning to read is an important part of your child's development and affects how your child does in school and in life in the future. You can help your child get better at reading, no matter how well your child or you can read right now. Try.
Okay, I think this is in Spanish.
Hacer preguntas le ayuda a su hijo a aprender a pensar y a que él haga preguntas también. También le ayuda a aumentar su vocabulario y comprensión. Esto puede hacer preguntas.
And I think this one is the Arabic.
وتأكد من منح العمل الذي يقوم به حتى إذا كنت تشعر أنك لست قارئا جيدا بنفسك فلا يزال بإمكانك مشاركة الكتب مع الطلبة.
And the last one I think is in Vietnamese.
Em trong một khoảng thời gian ngắn và tăng dần thời gian đó lên nếu các em cảm thấy tự tin và thoải mái. Nếu có thắc mắc hay câu hỏi gì thì quý vị có thể liên lạc với giáo viên lớp hoặc các nhân viên nhà trường để được giúp đỡ. Em trong một
Okay, thank you so much. I want to again do a shout out to our community-based partners, as well as the Stanford MCHRI and the Ikiko Yamazaki and Jerry Yang Faculty Scholar Fund for funding this project. I don't think I would have found another way to do it initially, so I really appreciate it. Thank you.
Great. Thank you, Dr. Loe, for sharing that. It's quite inspiring, and also seems like it was fun to do that kind of research. We have 1 minute for questions. How do you think that growth mindset will translate into other changes for this population?
Yeah, I think it's a really interesting question. I don't think it's going to solve, right, all the root problems and causes of inequity. I do think that on a parent-child level, I think that it could really help improve interaction and also like sort of that frame of mind. There's a lot of study of different constructs like resilience and grit and, growth mindset and things like that. And I think, while they are separate constructs that people have, kind of operationalized and looked at in different populations, I think that they're kind of sometimes tapping into some similar ideas and strategies. And I think that, that can be really helpful, in terms of not feeling so predetermined, where certain things are. So, I mean, the data in terms of showing associations with growth mindset with more positive outcomes is pretty strong. So, our own Claudia Mueller, a pediatric surgeon, has looked at growth mindset in relation to health. And when she looked at adolescents with diabetes, the ones who had growth mindset had better hemoglobin A1C and were more likely to check their blood sugar more often. So, feeling that they had more control and that their behavior made a difference, in terms of their health, made a big difference in terms of compared to, people who had fixed mindset where they felt that their health was more determined by their genes alone. So I do think psychological frame of mind is important, but obviously there are many other things. And I so appreciate the work and the careful attention that people are doing about upstream determinants and structural racism and institutional racism, because it's really, really important.
Great. This was a really nice collection looking at, 3 different aspects of really important work that's going on here at Stanford. And Dr. Robinson, I'll turn it over to you to summarize this second group of excellent presenters.
Yeah, I don't need to, I think, summarize it as much as point out that that this is just a taste of some of the work that MCHRI is funding and supporting the investigators and the projects. in these areas of diversity and promoting health equity, reducing disparities, and promoting social justice. There are also many other projects that are highlighted in the posters around these areas as well. And we hope that area to grow. Related to that, please, we have an hour break now. And so please go and check out the posters if you haven't already. We have 92 posters that include abstracts, actual posters, and videos that the presenters have included in that. And then please come back at 1 o'clock for the Leadership Award to Dr. Maldonado. Thank you very much.